What is IBD? IBD is termed as inflammatory bowel disorder, which is a term used to categorize disorders that lead to a chronic inflammatory reaction within the digestive tract. There are two main types of inflammatory bowel disease: Crohn's disease and ulcerative colitis. Crohn's disease involves the inflammation of the digestive system lining that spreads down to the affected tissues. Ulcerative colitis, on the other hand, leads to long-lasting ulcers and inflammation within the inner lining of the rectum and the colon. Both of these conditions lead to abdominal pain, diarrhea, weight loss, and fatigue, which can be debilitating and can lead to certain life-threatening complications. The symptoms in inflammatory bowel disease vary depending on the severity of the condition, ranging from mild, moderate, to severe. The signs and symptoms include blood in the stool, reduced appetite, weight loss, cramps, abdominal pain, fatigue, fever, and diarrhea. There is no such exact cause of inflammatory bowel disease, but there are certain risk factors that increase your risk of suffering from the condition. Stress and diet are also considered risk factors that might aggravate the condition. A malfunction of the immune system can also lead to inflammatory bowel disease, as your immune system is weakened and is unable to fight against virus or bacterial infections, which ultimately attacks the digestive tract cells. Hereditary can also cause increase to your risk of suffering from inflammatory bowel disease. It is commonly seen in people who have a family history of it. Most people suffer from inflammatory bowel disease during their 30s, but it can also occur during the 50s or 60s. Certain races, for example Caucasians, are at an increased risk of suffering from IBD, but it can also occur in different races and ethnicities, including Ashkenazi Jewish descent. Cigarette smoking can also increase your chance of suffering from Crohn's disease. However, the overall effects of tobacco are harmful. NSAIDs, or non-steroidal anti-inflammatory drugs, can also increase your risk of suffering from inflammatory bowel disease, like naproxen sodium, ibuprofen, diclofenac sodium, and others. People who are staying in industrialized countries are also at increased risk of suffering from inflammatory bowel disease. Environmental factors like refined foods or fatty foods can also lead to IBD, including for people who live in northern climates. Certain complications can occur in both Crohn's disease and ulcerative colitis, such as colon cancer, joint inflammation, skin inflammation, and eye inflammation. Blood clots and primary sclerosing cholangitis can also occur as a complication of inflammatory bowel disease. Complications that are restricted to Crohn's disease include malnutrition, bowel obstruction, fistulas, ulcers, and anal fissures. Complications limited to ulcerative colitis include perforated colon, toxic megacolon, and severe dehydration. The diagnosis of inflammatory bowel disease can only be confirmed once the symptoms are ruled out. For further confirmation of the disease, blood tests are advised for infections or anemia. Fecal occult blood tests are also recommended. Endoscopic procedures for diagnosing inflammatory bowel disease include flexible sigmoidoscopy, colonoscopy, capsule endoscopy, upper endoscopy, and balloon-assisted enteroscopy. The imaging procedures for inflammatory bowel disease include CT scans, X-rays, and MRI. We hope that you are learning something new every day from our videos. If you'd like to know about a specific topic, inbox us, email us, or comment down below.